Hello, everyone. Welcome to today's lecture on sexual health and well-being. We're going to define relevant and useful sexual health terminology, understand important sexual health and safety information, looking specifically at consent, what it is not, and sexually transmitted infection rate statistics and safety practices. And then lastly, we'll look at important options for your reproductive wellness. So before we dive in, I want you to consider our 8-factor wellness wheel and how sex and intimacy might impact either area for you specifically. This is going to differ for everyone. So how might sex positively, negatively, or neutrally impact your emotional well-being, your social well-being, physical or intellectual? You can pause this if you want, take some time to think through it and think about how sex currently might impact any of these areas and how it could if you had optimal sexual health and well-being. Now let's look at some terms and definitions. So important ones to cover that many folks, though not everybody, is aware of are the differences between sex, gender identity, and sexual orientation. So first, let's look at sex, sometimes referred to as biological sex. Sex is a label assigned at birth that's based on external genitalia, typically, but not always, concordant or in alignment with one's sex-based chromosomes. So typically, sex is defined by medical professionals at birth, whether a baby represents as male or female, but there are cases where it's ambiguous, where a baby may represent with traits or reproductive organs that don't make it clear whether they are totally female or male. And this is considered intersex. And research suggests about 1 to 2% of the population is considered intersex, where they don't have clearly distinguishable external genitalia. And this may be because of chromosomal abnormalities. This may be because of hormone receptive disorders or because of certain hormonal exposures in utero. So this can happen and it's not typically dangerous or abnormal. It just results in the expression of both male and female sexual traits. And so at times, and more often in the past, medical professionals and parents made the decision to perform surgery to um, skew the view of the external genitalia towards one sex or the other. Oftentimes now they are leaving it alone and letting individuals choose to make changes or not as they move into adulthood. Gender is different. Gender is not a medical label, rather one that defines how an individual is looked at societally. So this is really a societal construct that considers the expectations, the characteristics, and the behaviors that are common or thought of surrounding what male and female is. So where sex is more of a biological term, gender is a societal or social construct. And this considers what people think little boys and little girls do or do not do, or like or don't like, or how men or women act, behave, dress, speak, engage with others. And these are largely impacted, if not completely impacted, by our social environment. Now, someone's gender identity is how they feel about their own personal gender. So while someone might be labeled as male at birth, they may feel that their gender represents more of a feminine gender identity. So one can feel that their gender is male, female, or other altogether. And then lastly, one's sexual orientation differs from the two categories above and has nothing to do with sex or gender, but sexual orientation refers to who an individual is attracted to and with whom they desire sexual, romantic, and or emotional relations. So let's look at that a little bit deeper, looking at the Kinsey scale. So the Kinsey scale was developed by a group of researchers in the late 1940s studying human sexuality. And what they found is that, contrary to popular belief at the time, where it was thought that individuals were either heterosexual or homosexual, individuals actually fall across a range of spectrums of sexuality, as is true for many characteristics, behaviors, likes, dislikes in life, right? So this falls from a 0 to 6 scale and includes asexual. So if someone's not on the scale, asexuality represents having no sexual attraction or very limited sexual attraction to either gender. 0 on the scale represents exclusively heterosexual. Someone would have only heterosexual drives and attraction. And a 6 would represent exclusively homosexual. One would have only homosexual or same sex drive and attraction. Whereas a 3 would be considered bisexual, equally hetero and homosexual. So an individual who is equally attracted to both. But you'll see that there's actually a scale here between 0 and 6, where an individual may feel mostly attracted to the opposite sex, but also occasionally attracted to the same sex, or mostly attracted to the same sex, but also occasionally attracted to the opposite sex. So the cool thing about this scale and how amazing it is that it was actually created in the 1940s is that all of these sexual orientations to the opposite sex, to the same sex, to no sex at all, are completely normal variations of sexuality. And now, before we go into some of the trickier stuff around sex, looking at consent, looking at safety, looking at sexual health and reproduction, I want to look at some of the research supported benefits of sex. And let me tell you why I do this. Much of the sex education in the United States focuses on risk and aversion, right? We take young people and we tell them, if you have sex, you can get infections, you can get diseases, you can become pregnant, you will, your life will be taken off track. And while some of those things may happen, there is a likelihood of those things, or there is a chance that those things may happen, there are also positives to sex. Otherwise, people wouldn't engage in it. And research shows that fear-based sex education actually does a poor job of preventing sexually transmitted infections in early pregnancies. So other countries, many Norwegian countries, have more modern sex education, we should say, that balances both the pros and cons of sex and sexual behavior. So young people are taught both about the potential benefits and the potential repercussions of sex, right? It may be enjoyable, it may improve relationships, it may improve connection, it may feel good, and there are risks to it. There are infections that could happen. There are pregnancies that could occur. So it's important that we look at both potential positives and potential negatives, which is why I started this by having you look at that 8-factor wellness wheel and figure out, how does sex play a role in your life right now, or how might you like it to? So let's look at some of the research-backed benefits. We see improved relationship satisfaction. So when individuals in a relationship are having sex, and the research actually shows up to 1 time a week, that relationship satisfaction and general well-being, self-reported rates are higher. And if we see data on sex beyond once a week, we don't see increasing rates of satisfaction and happiness. Higher self-image, self-confidence. We see reduced stress response hormones, so the lowering of cortisol and adrenaline. So if you've ever had an experience that was really stressful, and then you felt an increased sexual drive or sexual urgency afterwards, this is not actually all that uncommon. It's a way that your body is trying to ameliorate the increase in stress hormones that are happening in your body. Increased oxytocin, which is often referred to as our love, bonding, or connection hormone. This is increased immediately after delivery, during birth, during breastfeeding, and during sexual activity. We see improved immune function, and for women, we even see reductions in menstrual cramps. Not to mention, there may be improvements in physical health from the general physical activity that occurs with sex. So it's important to keep in mind that there are benefits personally, relationally, and not all of these are just with partnered sex. Many of these, to an extent, are with solo sex as well. So there are benefits to sex that need to be balanced with the potential concerns or repercussions related to infections or unplanned pregnancy. Now that we've done that, let's move into some sexual health and safety information, particularly looking at consent and sexually transmitted infection. And before we do this, I'll give you a chance to glance at the World Health Organization's sexual health and reproductive health definitions. And I'll just read the sexual health one to you and then a piece of the reproductive health. And here it says, sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not just the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. So there are many keys here. They highlight how it can affect physical, emotional, mental, and social well-being. It's not just the absence of disease, right? It's not just not getting an STI. we're not having an unplanned pregnancy, right? There's a lot more to well-being and to sex overall. It requires positive and respectful approach. So positive of someone's gender identity, respectful of someone's sexuality or sexual orientation, and the possibility of safety and pleasure. And I would argue that you can't have pleasure without safety. So we're going to look at that first. And then I'll read just the end of the reproductive health one because the beginning is largely the same, but it implies that people are able to have a safe and satisfying sex life, and that they have the capacity to reproduce, and the freedom to decide if, when, and how often to do so. Okay, let's look first at consent when talking about sexual safety. Consent is an absolute critical component, key benchmark to sex and sexual activity. So let's look at the definition here from RAINN, the Rape, Abuse, and Incest National Network, that has a bunch of resources around sexual health, sexual safety, and consent that I've included in this week's module. Consent is defined as an agreement between participants to engage in sexual activity. It should be clearly and freely communicated. Both verbal and affirmative expression of consent can help you and your partner understand and respect each other's boundaries. So let's go through a few of the keys here. It's an agreement to sexual activity and to the specifics of sexual activity. It's verbally, clearly, and freely communicated, and it's communicated through body language. A couple keys about consent. It cannot be given by individuals who are underage. So under 18, individuals who have sex with those who are over 18, that's not legally considered consent. Intoxicated, so under the influence of alcohol or other drugs. And I have had a former sex crimes prosecutor come speak to classes in the past about this. And even if both individuals are intoxicated, charges still can be pressed. If an individual is asleep or otherwise unconscious, they cannot legally give consent. Consent can't be given with any kind of coercion or unequal power dynamic. So this could look like boss employee, teacher student, coach athlete, anything where there is an uneven power dynamic. Consent cannot freely be given. There's some sort of coercive nature there. And an important thing to know is that consent can be withdrawn at any time. So even if someone says yes, and they later say no, that means consent is revoked. Now, Planned Parenthood has a great acronym here around consent that is FRIES, and the F is for freely given. That means that there's no coercion, power dynamics at play. Reversible, meaning that an individual can change their mind at any time. Informed might mean around someone's sexual health status, around the number of partners that they're currently having, right? That it's accurate, that it's truthful. Enthusiastic means that the body language, the tone, everything going along with the words also indicates yes. And then lastly, specific. So specific to the behaviors, the sex acts that will or will not be performed, the things that folks are and are not comfortable with. And while this might seem very technical or clinical, it can be done in a way that is not so. Okay, now we are going to look at sexually transmitted infections. So here is an infographic from the CDC looking at some STI statistics, and we call them sexually transmitted infections because it is an infection. It may or may not progress into a full-blown disease state, but initially it's a simple infection. So let's look at some of these data. Young adults account for the vast majority of sexually transmitted infections in the United States. So adults 15 to 24 make up 27% of the population, but account for half of annual new sexually transmitted infections in the US each year, of which there are 20 million. So there are quite a few. One thing to take away from this is that it is fairly common. Young people account for a substantial new portion. So you can see the purple here is young people. If you look at gonorrhea, chlamydia, HPV, genital herpes, HIV, and syphilis, you can see the proportion of these which are occurring in individuals ages 15 to 24. And you can also see that there are some dire statistics for women. Consequences, 24,000 women each year become infertile from sexually transmitted infections. And many people don't know they have an STI because oftentimes there are no symptoms. We'll look at that in a minute. Now, why are young people getting STIs at a greater rate than older adults? One thing may be insufficient screening, confidentiality concerns. People are worried to go talk about their sex behaviors with their doctors. Let's see, lack of access to healthcare. So if someone doesn't have safe healthcare, if they can't get there, and they can't get tested, and young people are more likely to have multiple sex partners than older adults. So let's dive a little bit deeper into sexually transmitted infections. So symptoms, symptomology. How do you know what might be, again, might be symptom of a sexually transmitted infections? Remember that many STIs have no symptoms. So again, 15 to 24 are most likely to acquire an infection, and gay and bisexual men, or men who have sex with men, are also more likely to acquire an infection just via the nature of the sexual activity. Now, both sexes are impacted, but as the prior slide stated, women have more severe consequences than men, leading up to potential infertility. Oftentimes, people forget about infants, but they're also a highly impacted group, as they may acquire neonatal infections that are passed from mother to infant in utero or upon delivery. Although many sexually transmitted infections are screened for during pregnancy. So let's see, what are some symptoms that men and women may experience of varying sexually transmitted infections? Sores, bumps, or blisters near the sex organs, any sex organ, or the mouth, often indicative of things like herpes, herpes simplex virus, HSV, or HPV, human papillomavirus. We'll look at both of those. Burning or pain during urination, swelling, redness in the throat, fevers, chills, or aches. So the onset of initial infection might have fevers, chills, aches, what you might experience with a general infection. Swelling of lymph nodes near the neck or the genitals, and then feeling the need to urinate frequently. Those may be symptoms of varying sexually transmitted infections. Beyond that, for men, they may experience a drip or drainage from the penis. For women, vaginal discharge or odor from the vagina, discolored vaginal discharge, pain in the lower pelvis or deep in the vagina during sex, burning or itching around the vagina or vulva, and bleeding from the vagina at times other than the menstrual cycle. Now, again, there may be no symptoms at all. And if you look at these symptoms, some of them may be similar to urinary tract infections or yeast infections. So sometimes folks may think, oh, it's just a UTI or it's just a yeast infection. This is one reason that it's very important to get tested with or without symptoms. And we'll look at how often an individual should do this. So what are some possible ways to, I would say, reduce the risk of acquiring a sexually transmitted infection? The only way to certainly prevent an STI is to not have sex, to abstain. The ways to reduce risk, though, are listed here. They are quite common. Estimates suggest that up to 1 in 2 Americans, or half, will acquire an STI at some point in their lifetime, and nearly 1 in 5 Americans, or 20%, have one at any given time. So they're much more common than we think. And part of the reason for that is that folks aren't talking about it and folks aren't always getting tested. So what can you do to reduce your risk? Well, you can have fewer sexual partners. Of course, the fewer people that you have sex with, the lower chance you have of acquiring a sexually transmitted infection. You can practice mutual monogamy, which means that both you and your partner agree to only have sex with one another. You can use a condom if you're having sex that involves a penis, even with additional birth control. So sometimes folks will say, oh, I don't have to use a condom, I'm on birth control, or you're on birth control. And while that may greatly reduce the odds of unplanned pregnancy, it does not protect against any sexually transmitted infections. The only method of birth control that protects against sexually transmitted infections is the condom. Get tested regularly and share test results. And then vaccinations will not necessarily prevent, they'll reduce the risk, and they'll reduce the risk of infections turning into certain types of cancer. So there are vaccinations for HPV, human papillomavirus, and getting vaccinated can reduce the risk of the development of cervical cancer in women. So when should an individual get tested? Here are some general guidelines. Whenever you've had sex with a new partner, no matter how much you know them, how much you've discussed, you don't know, or your partner might not know their full sexual health. So getting tested is a good idea. If you've had unprotected sex, if you're experiencing any unusual symptoms with any sex organs, mouth, throat, vagina, penis, anus, you're sexually active and have never been tested, or you'll likely get tested if you become pregnant. And some places you can get tested, your own doctor's office, if you have one, you can typically get it done, any Planned Parenthood center or community clinic. GYT Now is a website that can help you find testing places in your area. And then if you're here local to San Diego, Mesa Student Health Services can run a basic STI panel. One thing to know, though, is that these typically test for things like chlamydia, gonorrhea, syphilis, and trichomoniasis. They don't always test for things like herpes or HIV. And if you're concerned about those, you may have to ask for them specifically and get a blood test. Potential outcomes of sexually transmitted infections. They can increase the risk of getting or transmitting HIV, human immunodeficiency virus, because of increased opening of skin and sores that may transmit bodily fluid. They can lead to pelvic inflammatory disease, infertility, ectopic pregnancies, which is where a pregnancy occurs in the fallopian tubes. As mentioned, HPV, human papillomavirus, can lead to cervical cancer, and perinatal and congenital infections to infants born to infected mothers. So there are some very serious risks, which is an important reason to get tested. What if you find out that you have one? This can really feel embarrassing, uncomfortable, yucky. However, as we just saw, lots of people have them at some point in their lifetime. What you can do is follow your physician's guidelines, let your recent partners know, let any future partners know, and know that it doesn't mean anything about you. It just means that you're a human who got an infection, just like many humans do. So ones that you're going to look at this week, we're not going to dive deep into each one and pull up pictures and do that and go that route, because research shows that it's not actually beneficial in reducing the spread of sexually transmitted infections. So what we'll do is just briefly talk about the different categories, and you can explore these further this week in your Planned Parenthood resources in this week's module. The two general categories of STIs are viral and bacterial. And important things to note are that bacterial infections can be treated with antibiotics. Viral infections cannot necessarily be treated, they can just be managed. So this is one reason that it's so important to practice safe sex, get tested regularly, and speak openly with your partners. Typical or common bacterial infections are gonorrhea, syphilis, chlamydia, and trichomoniasis. And these may cause some of the symptoms that we showed earlier, but importantly, they might not cause symptoms at all. And these ones can be treated with antibiotics again. So this is another important reason to get tested, because they can cause long-term implications if they're not treated early on. Some viral infections include HPV, human papillomavirus, which is the most common sexually transmitted infection. This can cause genital warts, but often causes nothing at all. And this is the one that can lead to cervical, mouth, or throat cancer if it goes untreated. Herpes simplex virus, often referred to as HSV1 or HSV2. This is a virus that involves sores, sometimes referred to as fever blisters, that often occur around the mouth or sexual organs. HSV1 is typically referred to as oral herpes, and HSV2 is typically referred to as genital herpes, although because those sex organs can be intermixed, so too can these viruses across both areas. Human immunodeficiency virus, HIV, is the precursor to AIDS. Again, this can't be treated, but it can be managed. And there are medications that individuals can take, like PrEP, in advance, that are prophylactic, that decrease the risk of getting or transmitting HIV. And then lastly, hepatitis, which is a virus that affects the liver, and this can be transmitted through sexual intercourse or through things like unsafe needle use. So these ones don't have treatment, but can definitely be managed. The symptoms can be reduced in severity, and the risk of transmitting with others can be lowered as well. So my takeaway here is to get tested, practice safe sex, get tested, so you know what you're working with and what the other folks you're working with are working with. All right, we'll go ahead and stop there. Take care.